Hi everyone, let's welcome again to talk about life.
They take these vaccines so their body also know the procedure of developing antibodies. You understand that? So when a new virus comes, the body already know what the process it has to go through. The last time it went through when it was injected polio vaccine. So the body knew steps that now I have to develop antibodies. But like the situation, like in developed countries, Singapore, maybe, Japan, US, you guys are not vaccinated those medicine or you're not giving those vaccination because those diseases have already been erased from your part of the world. So that's why also there is no dust, there's no smoke, there is no pollution. So your systems are really sensitive. You cannot inhale. The water is always clean. So do you understand that?
Okay,
So
now I get it
when,
from the
yeah,
general public point of view. Yeah, I mean you made it so
yeah.
so clear now. It's much easier to understand because in countries like us, we don't have a lot of vaccination, and it's
Exactly.
fascinating for me. Like you and your brother, you're in the medical field, you're working in the hospitals. Tell us how. Uh, some of the scenarios, maybe two of the scenarios at the peak of the situation and now the situation. Tell us how are the hospitals reacting?
So at the peak of the pandemic, it was really hard because in our countries, most of the medical graduate are women. Let's say 80% of the medical graduate are women in living in Asian Muslim communities.
Yeah.
These women don't get to practice. They get married and they just quit their practice. So the only practicing doctor that come into the field are that 20% male that went into universities and 10% of these female. So of course we have already lack of doctors in every field. So when the virus came, it was really hard situation. We had lower workforce. We were not ready for it and we did not know. So what the government did, they actually started recruiting all the frontline nurses, dentists, pharmacists, physiotherapists, everyone from medical field and started training them with the doctors. So they were, because in medical field you have the basic studies are same for everyone.
Yeah.
And also they did involve the final year student and third year students. So this was the huge impact that it brought into students, and by then we were only able to fill that gap that we had because of the lack of doctors and healthcare workers. But now situation is really under control, and in most of the hospitals we have staff, we have people, doctors are already trained, and the situation is not very bad. Also, in starting, the government did separated the corona centers from the normal hospitals. So it was one of the biggest achievements that they did. Because of that, they made different centers for corona or COVID patients for quarantining them. And also they made classes, like the severe cases would go to certain center. The cases which are asymptomatic might stay at home and quarantine there at their homes. The cases who have mild symptoms might stay at quarantine at their homes or maybe at one of the facilities by government where they were providing food, where they were providing electricity and internet. So it was really good, stepwise, this facilitation by government was really good. We did not expect it. We did not expect it that our governments are going to perform so good, but it eventually did. And it was really, even now, all the centers that were made specially for COVID patient has ended now. Now, the only patients that are reporting of being diagnosed with corona or they are being tested negative for corona are now being sent to the government hospital. These are already in city. So the situation is really under control and daily. And even I told you that the herd immunity has played a greater role And most of the population in Pakistan, 70% of us are
Yeah.
young adults, or they are really young. They are from 17 years to 35, 40 years, not more than that. So 70% of them have already strong immune system. So this is really good. And other than that, um, yeah.
And can I now, and I want you to explain more about herd immunity to listeners and to viewers, and also about, you talked about very quickly the government ramped up training and recruited the doctors and the nurses who were not practicing anymore. Tell us the time frame. How did they roll out? Iman, it's really almost like a real time emergency training. Tell us how it was rolled out, and probably give us or people listening in general, how does a country ramp up so quickly the training for fighting COVID for the medical team to get them ready mentally or physically, medically ready to do that. Tell us these two things.
So I want to start my thing that I want to start this topic before I want to tell you to know about Pakistan culturally.
Yeah.
So Pakistan, especially because it has a lot of youth, people are really pumped up when it comes to something to volunteer at. Especially Pakistani people are passionate about their country. So whenever we have crisis, yeah. So whenever we have crisis, people
Wow.
automatically do come up and they want to help other people. This was one of the best things.
Respect.
Yeah, thank you so much. So what happened actually, that government did divided every city into certain numbers. Like
Yeah.
if I might talk about Karachi, then you might have the idea that what happened. So government did divided Karachi. Karachi is really big city. We have population of 2.5 million people here only in Karachi. So it's a big number. So government did divided Karachi into 7 zones, and every zone had its own hospital. So every zone had one of the government officer from he was working. So he started recruiting team of nurses, paramedics, doctors, dentists, any kind of person who was related to health here. They form a team of them. Then further, they made a team of specialized doctors. They were trained in epidemiology, and they made another group for students who were in third year and in final year or the fourth year of their studies. So third year student do actually have, they do get exposure of how the hospitals work, what they do in wards. So now the first they form a team of the specialized doctors in epidemiology. One was put as head, and under him they put a team of 10 doctors who were already practicing in different hospitals. So they asked them to start training these 10 people according to the epidemiological studies, that how to prevent themselves, how to, you know, uh, work in COVID stations, how to protect themselves. Then under these 10 doctors who were already getting training, they give every doctor 10 other people who were nurses. So nurses or from other healthcare profession like dentists, like physiotherapists, psychotherapists, I forgot. Um, yeah, pharmacists. So they gave further 10 students under them. Also, they said that now that you all who have already got training, so these training involve general skills, how to give cannula, how to take care of patients, how to measure temperatures. So they were given very basic medical training, which they were already doing in their hospitals or in their educational facilities before in their studies. So when they were trained, these all people were sent to their homes, and only the epidemiology doctors and the medical practitioners were working together. So whenever there was a shortage of doctors in the field, the doctors have the database made with the head of that zone, and that zone officer would email them that you might be needed to come here and work with our staff. So same was repeated in nurses, same was repeated in other healthcare professionals. So once there was a doctor who might be exposed to COVID, or they might have
Yeah.
other problems, they might go, they might get drained because they were working so many hours. So they already had a trained lot of people who would come and replace them for every 15 days. And before even starting the duties, they already informed us that we might be working in these stations for 2 months, 3 months as a specialized doctor. So we did not have to, we cannot to run from it. So we have to make our mind, and at that time it was really crucial time, because being a Muslim majority country, we had Ramadan. So it's a really precious month of Muslim.
For
And then
fasting.
we have Eid, yeah, the fasting and the feast, and there were a lot of religious celebration that were continuing in that time periods. So they said that you might not be able to go back to your homes because you might be serving at these centers. But because the teamwork was really good, so the doctors were really cooperative of each other. So they would always give 15 days duties, and they'd allow their other doctors to take rest for 15 days. So the cycle was really good, and it keep on multiplying itself.
So, okay, just a little bit of my interpretation. So everyone has got this pyramid structure, right? That rolls out. Wonderful. Immediately you've got people below you, and people are going to train in a very systematic fashion. Um, Next, this 15-day rotation, does it mean for 15 days the doctors or nurses, the medical staff are confined in the hospitals and not out of the hospitals? Are they allowed to go home, or should
So
they be safe to stay in the house, in the hospitals?
okay, so because these hospitals were special hospitals, so the
Yeah,
doctors were actually a colony was specially prepared for these doctors, and army was called for the security, and the police was there for the security. So these areas were actually they had three zones.
yeah,
One was red zone, then it was green zone, and the other one was white zone. So the doctors who were actually working in red zone, they had special kind of housing facility that they were using.
yeah.
And then they, for their duties, they were not having interaction with any of the people in green or white zone. So they were not able to go home until the facility was cleared of all the patients. They were not allowed.
I see. So they have to wait until the red color turns to
Yeah.
white.
Yeah. So, but the doctors who were working in green facilities, they were given the chances to go home. They were given options if they might want to stay at facility, or if they want, they can go back to their homes and come. So most of them opted to stay at their homes and come and back every day, commute. So and then it one of the white zones. So those people were mostly, they would stay at home, and they would only be called once they have to do some job in the facility. Other than that, they had no need there. So of course it was a much load on the red zone doctors, but then these doctors were specialized doctors, so they had a lot of helpers within their zone. So what they were given rest within their zones in that facility. They were not allowed to go back to home because they were needed there. The guidance was needed there because I already told you there are not many specialists. So that's why but before that, sorry, let me complete. So, but before starting the duties, they were already being educated that they might have to stay there up to 6 months of.
And you were saying that there is a central um, governing task force, right? It is, I mean,
Yeah.
is a doctor, is a ministry. how did that explain this like the central body of the medical, the top medical body?
So actually, what happened that there were few doctors who were in direct contact with the government teams and WHO teams. So they were head of the whole. They were given the operations.
Yeah,
So they were head of the operations,
yeah,
and they all were allowed to recruit their team to work in their facilities.
yeah,
So these doctors who were working centrally, they were
yeah,
working in close relation with the army officials. The army was
mm,
at these stations.
yeah,
The armed force was at these stations. They were looking for the security. They were looking for the food. They were
yeah,
looking for different kind of working at the facilities. So
yeah,
they were in close contact with them.
yeah,
Other than that, the junior doctors were in contact with the main bodies. So they were all connected in certain way, but
mm,
even being they were, if you might look at the model, you will see that every person was answerable to a head.
yeah,
It was a one person who was head of the whole team. So every
yeah,
10 people were answerable to one of the heads, and that head was answerable to his head.
yeah.
So they did made a hierarchy in which everyone was working and everyone was being answerable to the
Mm,
top head that was running these all facilities.
yeah. Um, explain also your Ministry of Health. I suppose the top part of the government was the Ministry of Health. Do you call it the Ministry of Health or the Secretary of Health?
Yeah.
That worked closely with WHO. I'm just wondering, like, um, this whole map of I should say it's like a battlefield map, right? Is there some who are behind this battlefield map? For example, you were saying that Karachi was divided into zones, 8 zones, etc., and then each zone has got its own hospital, etc. I suppose the whole of Pakistan was under some kind of system, right? Yeah.
So, see, actually, to understand this system is very complicated. So, the only person who might be able to understand that they should know about a little bit about politics of Pakistan. So,
Mhm.
Pakistan basically have four provinces. So, the one province is being regulated by one governing party, and the three provinces and the center government is belong to one party.
Mhm.
Although they did have a lot of conflicts between them, so they were both dealing corona in their own ways. So the
Oh,
one of the province that I am from, Sindh, they have the governing body. The health minister herself is a doctor.
yeah,
So she was looking at all the operation
yeah,
from herself, by
yeah,
herself.
yeah.
She did not take help from any other countries. She did not take help from WHO. She only took help. She did not outsource anything. She was only taking help from the people that were living within the province, the doctors that were living within the province, and the hospitals that were in the vicinity. They were setting up new clinics. The only help that they took from the central government was for the funds, because they needed funds to set up new centers for COVID patients
Yeah.
and COVID kits. Then the center government, who has already three provinces under them, they were taking help from the WHO and China. So they did get aid from China of lot of
Medical
masks
aid,
and
supplies.
yeah, medical equipment, medical supplies. They did get a lot of moral support from different countries and different bodies who were working in medical field. Especially WHO was really working in close confinement with them on every situation. So although the both of them did looked after the corona situation differently, but the government, which was working in one province, which was mine, they did look after the situation really effectively. They were able to look after the situation really effectively. So, can you give me 1 minute?
Yep.
Yeah. So,
Okay.
so sorry.
Yeah.
Actually.
No worries. I'm still okay. That's the first part of
Yeah.
it.
No,
I want to know.
yeah, please, please.
Yeah, I want to know more about herd immunity. Okay,
Yeah,
but for us to establish herd immunity, my understanding from the news that I read is 70% of the people must have some form of exposure, and they must have built this. They must have first exposed to it. Um, Either they succumb to it or they don't succumb to the virus, but they have a certain kind of immunity. So because 70% of people have been exposed to it, it makes 100% of them safe. Now, I want to ask the technical part of it, and because I'm so fascinated by your description, and the world should really know, statistically, how did you all, because you did tell me like they took samples, 20,000 sample, right, from certain provinces. So
yeah.
20,000, and then out of 20,000, they could have mathematically calculated, okay, 70,000 blood samples and 70% of them already have the antibodies. So you can kind of conclude there is herd immunity in these provinces, and then therefore the country has herd immunity because 70% of the population is already being exposed. Now, but I want to know how did you all get these in real practical ways to get these 20,000 samples and in the hospitals test them out? You know, I'm so intrigued by this. Number two is you said young people, right? Which is what's happening to a lot of countries, right? Like India, you've got really young population, but the death rate is like the fatality rate is like really low. You know, because people were not. I should say that people were really strong. They've been exposed to all these very difficult diseases throughout the history in the country. So, like in Pakistan, um, this immunity that you all already have, and now you've got this immunity, how does the rest of the world, which we don't have the vaccine before, like you say, you know, is it realistic for certain countries to go for that herd immunity model, which,
So,
which was theoretically at the very beginning was one of the ways, and that's why Sweden wanted to practice herd immunity. They didn't have lockdown, no mask, nothing. So I want you to explain, number one, how did the country go on to take 20,000 samples and get it like tested? And also the model of herd immunity, is it replicable in different kinds of places?
see the let me, let me make it really simple. So, start from what is herd immunity and
Yeah,
how did herd immunity actually do develop in humans.
yeah,
So, herd immunity is actually any situation in
yeah,
which a large number of people are being exposed to that virus, and therefore being infected with the virus, they they have already start their body start reacting to the virus. So when their body start reacting to the virus, the further spread of virus is, now I am, let's say if I have COVID and it has already entered into my body, and we have 6 people in our home. So
mhm,
if I might have, and it spread from aerosols, so the chances are 70 or 80% that my brothers and my parents might already have COVID because I have it, and we
yeah,
are living in the same home. So because of this, now virus cannot, cannot go further. Now, let's say one of my brothers go to his work and then he gets exposed to 20 other people. So because of that, the virus starts spreading. Now, what happened in herd immunity, that the virus is unable to go any further, because now everyone has virus. It cannot affect anyone. Now, when does virus start showing its symptoms? So virus might have two types of symptoms: asymptomatic and symptomatics. Asymptomatics, that you have virus in your body, but it has not started showing any signs. Maybe because it might have not found suitable situation or suitable body surface, or it might have not found suitable circumstances within your body to expose itself. But let the other person who might have virus had maybe some cut within its body. Maybe he might have another disease before getting COVID, and because his body was weak, he was able, the virus was able to expose itself in that person's body. Now we both have COVID. I am asymptomatic because I am young, healthy person who is completely okay. I'm eating healthy. I am exercising. The virus is not getting enough points to get itself exposed. But that person who might have somehow some kind of disease or some kind of complication, the virus was able to work itself within his body. Now, we all know that we have one set of cells in our body, that is our white blood cells. So what do white blood cells actually do? White blood cells have ability to fight against all the all the outside body that enters within your body, uh, to fight against them. Anything which will enter your body, they alert white blood cells. The white blood cells, because they recognize every cell of your body. So if something that is coming from outside, white blood cells work and they said, this is not part of our body. So what should we do? So it's like our army of any country. They go and they want to fight against it. So let's say that person was really weak and did not have so much immunity against that virus. Their white blood cells start making different antibodies and start acting on them. Let's say that we start making certain ammunitions. The army start making certain guns and ammunitions, and they start training themselves differently to how to attack
Hi
this
everyone,
enemy.
let's welcome again to talk about life.